Welcome to Weekly Neurology Deep Dive. This deep dive is for educational purposes only. It's really just a summary of a recent research article. The paper is on antidepressant use and cognitive decline in dementia patients. To really get the full picture, we always encourage you to read the whole paper. It's called Antidepressant Use and Cognitive Decline in Patients with Dementia, a national cohort study. You can find the link in the show notes. This week, we're focusing on those practical insights for neurologists in their daily practice. So let's dive in.
This was a Swedish national cohort study. It followed 18,740 patients diagnosed with dementia, and it was looking at the link between antidepressant use and cognitive decline, and specifically how that was measured using the Mini Mental State Exam, the MMSE.
So how do they actually go about measuring the cognitive decline in these dementia patients?
They used the MMSE score, which, as you know, is a common tool for assessing cognitive function. They track changes in these scores over time to determine the rate of decline.
And what were the key findings then regarding antidepressant use?
The study found that antidepressant use, particularly selective serotonin reuptake inhibitors, or SSRIs, was associated with faster cognitive decline.
Can you kind of elaborate a little bit on what you mean by faster decline?
Sure. So patients taking SSRIs showed a decline ranging from 0.25 to 0.76 points per year on the MMSE. Now, this might seem like a small change, but it's important to consider the context.
What do you mean by context?
Well, clinically significant changes on the MMSE, those are typically considered to be a decrease of 1 to 3 points. So while the decline observed in this study may not be super drastic, it's still a noteworthy finding, especially when we're thinking about managing dementia patients.
Were there specific patient groups where this correlation was even stronger?
Yes, patients with severe dementia at the start of the study, so those with initial MMSE scores between 0 and 9, they showed a more pronounced association between SSRI use and faster decline. This just highlights the potential vulnerability of this particular patient population.
Did the study differentiate between different types of SSRIs?
Yes, they did. They found that escitalopram was associated with a more significant decline rate compared to another commonly prescribed SSRI, sertraline. This difference in impact between specific medications within the same class is something you might find useful in your practice.
So when choosing an SSRI for a patient with dementia, this information can be really beneficial in weighing the potential risks and benefits.
Exactly. It provides some valuable data points to consider when making those treatment decisions for your patients.
Now, the study also looked at the impact of higher doses of SSRIs, right?
Yes, they found that higher doses were correlated with an increased risk of severe dementia, higher all-cause mortality, and even an increased risk of fractures.
That's certainly concerning. It sounds like the dosage of SSRIs should be carefully considered in these patients with dementia.
Absolutely. It emphasizes the need for a cautious and personalized approach when we're prescribing these medications.
Now, moving beyond specific medications, did the study examine the relationship between antidepressants and different dementia subtypes?
Yes, they did, interestingly. They found that while faster cognitive decline was observed in Alzheimer's disease, mixed dementia, and vascular dementia, the same correlation was not found for Lewy body dementia and frontotemporal dementia. This suggests that the impact of antidepressants on cognition might vary depending on the underlying neurological mechanisms involved in each dementia subtype.
So the type of dementia a patient has should be a factor when considering antidepressant use.
It's definitely a variable to consider. It really emphasizes the need to tailor treatment plans to the individual patient, taking into account both their diagnosis and the potential risks and benefits of specific medications.
Speaking of risks and benefits, the study also mentioned the challenge of accounting for confounding factors like depression itself, right?
Yes, the researchers acknowledged that it's difficult to completely isolate the effects of antidepressants from the effects of the underlying depression, which itself can contribute to cognitive decline. They did try to adjust for this by including depression diagnosis in their analysis.
So they attempted to control for depression as a variable. But it remains a potential limitation of the study.
Yes. It's a reminder that observational studies like this can reveal associations, but can't definitively prove cause and effect.
And of course, there's the issue of adherence to medication. We don't really know for certain that patients took their antidepressants exactly as prescribed.
Precisely. The study relied on prescription data, not confirmed medication intake. So that's another inherent limitation of this type of study.
This study certainly adds another layer to this complex discussion surrounding antidepressant use in dementia patients. What are some key takeaways then for neurologists in their everyday practice?
I think first, It's important to remember that while this study highlights the potential risk of faster cognitive decline with antidepressants, particularly SSRIs, the observed magnitude might not be clinically significant for every individual.
So it's not necessarily a reason to completely avoid prescribing antidepressants for these patients.
Exactly. However, it is crucial to approach prescribing with caution. Carefully assess each patient, considering their specific dementia subtype, the severity of their neuropsychiatric symptoms, their overall health status, and their individual risk tolerance.
And it sounds like starting with a low dose of SSRIs and gradually increasing only if needed is probably a prudent approach.
Yes, particularly given the study's findings on the correlation between higher doses and increased risks. Closely monitor patients for any changes in cognitive function or emergence of side effects.
This study really emphasizes the need for a personalized approach, carefully weighing those potential benefits of antidepressants against these possible risks.
Absolutely. It's about finding the right balance for each individual patient.
The study also focused specifically on pharmacological interventions. Could you remind our listeners about the importance of non-pharmacological interventions when we're talking about managing dementia?
Of course, non-pharmacological approaches should always be considered as a first line of treatment for those neuropsychiatric symptoms in dementia.
Can you give some examples of those?
Certainly. Cognitive stimulation therapy, behavioral interventions, music therapy, and art therapy can all be effective in managing symptoms like agitation, anxiety, and depression.
These interventions aim to address the emotional and behavioral aspects of dementia without the potential side effects of medication.
Yes, and they often focus on enriching the patient's environment, promoting engagement, and improving their quality of life.
So it's about taking a holistic view of the patient and considering all available options.
That's a key principle in dementia care.
The field of dementia research is constantly evolving. With new studies being published regularly, how can neurologists then stay informed and ensure their practice reflects the latest findings?
Staying up to date with the latest research is crucial. Regularly reviewing relevant journals, attending conferences, and participating in continuing medical education activities are all important for maintaining clinical competence.
It allows neurologists to integrate new knowledge into their decision-making process and ensure patients are receiving that evidence-based care.
Precisely. It's about being a lifelong learner and continually refining our understanding of this complex disease.
This deep dive has offered valuable insights into the relationship between antidepressants and cognitive decline in dementia patients. This deep dive has offered valuable insights into the relationship between antidepressants and cognitive decline in dementia patients. Any concluding thoughts you would like to share with our listeners?
I think this study really underscores the need for ongoing research, into the long-term effects of antidepressants in dementia patients. We need more research to really clarify the optimal use of these medications in this complex patient population.
What specific areas do you think warrant further investigation?
I think it'd be valuable to kind of delve deeper into the varying impacts of antidepressants on different dementia subtypes. The study showed some intriguing differences, but more research is needed to understand why certain subtypes seem more susceptible to faster cognitive decline with antidepressant use.
So unraveling these nuances could lead to more targeted treatment strategies.
Yes, it could help us determine which medications are most appropriate for specific dementia subtypes and, guide decisions about dosage and duration of treatment.
Well, this study certainly provides much-needed data for neurologists, navigating these complex treatment decisions. It highlights the importance of personalized care, carefully considering the individual patient's diagnosis
Symptoms.
and risk profile.
I completely agree. It's about finding that right balance between managing neuropsychiatric symptoms and minimizing potential risks for each individual patient. And I think this study really equips us with valuable insights to guide that decision-making process.
To our listeners, thank you for joining us on this deep dive into the intricate world of antidepressants and cognitive decline in dementia patients. Until next time, keep exploring the depths of neurology.